Okay, I'm just going to give a few more minutes to make sure we are live. Okay, it looks like we are live, so welcome everybody. It's approximately 2:06 p.m. on January the 12th. This is the Greater Boroughs Partnership for Health Advisory Meeting. I'm just going to take a minute and read the North Boroughs remote script introduction. So this meeting of the Greater Boroughs Partnership for Health Advisory Board is being conducted remotely, consistent with Governor Baker's executive order of June 16th, 2021, an act relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the Greater Boroughs Partnership for Health Advisory Board are allowed and encouraged to participate remotely. And the order allows for us to meet entirely remotely, so long as reasonable public access is afforded so that the public can follow along with the deliberations of this meeting. The public is encouraged to following along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to the North Borough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. So I'd just like to take a moment to affirm that the board members are all here. So I'm just going to ask members when I call your name to please respond in the affirmative. So I guess we'll start. Dr. Alker.
Present.
Chelsea Malinowski.
Present.
And Jennifer Sullivan.
Present.
And Kristen Black, present. And I'd just also like to note our staff, Isabella Caruso, our shared epidemiologist, is here as well.
Aye. Present.
Okay. Thank you. So, okay, so our meeting is officially called to order and we can start to work through the agenda. I don't have a fancy presentation here today. I'm just going to be pulling up a couple screens to make through, sure we can work through this. So I hope all of our members have had a minute to look at the 2 meeting minutes that were circulated from both. We can start off with the September 8th meeting from last year. I just want to make one note, one edit I'd like to do, and I'm not sure how all your boards do it. We'd like to typically just put credentials at the top under the name of people attending. So we could write Heather Alker, MD, and then throughout the document, we won't use titles. We'll just refer to you as Heather Alker rather than like Ms. or Doctor or any of that. I don't know if you guys are agreeable to that change, if it works. Okay. So Heather, I'll put MD on that. Jen or Chelsea, do you need me to list anything after your names?
Nope.
Or does it? Okay. And then we'll just throughout the document, we'll just refer to everybody as their name, and under the listing will be there. And Isabella for present. Isabella's lucky to have her. And PH. So we'll throw that in there too. But so we can put those in. So I don't know. We'll open it up. If we have any motion to approve minutes, we can go from there. And any discussion?
I make a motion to approve the minutes for September 8th.
Second.
Okay. So second by Heather. Any discussion or edits to the minutes of September 8th?
No.
Okay, so we'll go by a roll call vote. So Kristen
Jen.
Black, aye.
Jen Sullivan, yes.
Heather Alker, aye.
Okay. And Chelsea's not going to be voting because Heather will be voting for South Borough here. And we do not have a member right now present from Boylston. So, okay, so those meeting minutes are approved. And then moving on next, if we want to take a peek at the November 17th minutes from 2021.
I make a motion to accept the November 17th minutes of 2021.
Second.
Okay. And so again, I guess for both of those, the only change that would be to the titles and removing titles throughout and putting any credentials in the first line. So I didn't have any comments on those. Any discussion? Okay, we'll go roll call vote. Kristen Black, aye or yes?
Jennifer
Heather
Sullivan.
Alker, aye.
Jennifer Sullivan, yes.
Okay, great. So those meeting minutes are approved of both the meetings. So we can move on to the contact tracing grant. So again, just to update everybody, like we are sort of full throttle on the grant, the contract's executed. I did receive an email last Monday from the state saying, here's your amended contract. And I was like, what? We already received the funds. Why are you amending our contract? So I was a little concerned, but really what they did, and I can circulate the language, before the contract, as we can all remember, said you have to do 100% of contact tracing. And that's just not doable. So the state, just like all of the same revisions, are just saying it's really focused on like congregate care, long-term care, schools, et cetera. So it's really in our favor that they understand, given the current surge, we just can't do it all. So I just want to make you guys aware of that. I mean, you sort of in public health, we all know what we're supposed to be doing now, but I did also inquire with Kevin Cranston with DPH about what's our flexibility here, right? If we're scaling everything back and these nurses or a staff or Isabella work on anything from vaccination clinics or, you know, whatever else we can think of public health needs, because don't forget the original grant when we applied said, you know, if their duties are fully met, they can do other things. But it sounds like right now the answer is a hard no to vaccination clinics. And I'm sure more is going to come out of this because every, you know, if we're on these regional calls, every community with a contact tracing grant is like, wait, what do we do now? So, yeah, it's unfortunate. So clinics are a hard no. And I think we really just have to figure out sort of next on our agenda is how do we best partner with the schools, right? Like I think our top priorities are schools, calling our seniors, you know, if we have an outbreak at our long-term care facilities in town, for example. So, I mean, I could speak a little bit for Northborough, Southborough, and Heather was, you know, also is in communication with them all the time. Everyone's so swamped with the schools. We're like, how can we help you? And talk to me next week. So I really think that's a process we need to work out. Our salmon staff under this contract are 20, we have 2 nurses brought on at 24 hours with also like a per diem line item. But again, that's stuck to contact tracing. So right now, Salmon has Amanda Jesse is another nurse that they have over there that's helping in Northborough right now under that to just close cases, just to go in there and close them out. So, you know, that's another thing that, you know, not only do we have the 2 24 hours, so it's Penny and Heather have been brought in and they are making calls. I mean, right now they're focusing on seniors and they're supporting Boylston. I know Heather, you know, you guys have pulled them, but, you know, so we're definitely focusing on those age categories, but I feel like in Northborough, Southborough, we have to figure out how better support the schools. And so one thought about that was having a meeting, like we need to figure this out. And same with you, Jen, and Westboro and Boyle. I mean, it's so hard, so many districts, different people, different processes, but that's what they're there for.
Right. I guess I'd be curious to know what, so Jen, you said the school nurses do the under 18, and are they still fully contact tracing in the school for in-school contacts? Because I know yesterday, right, the school district was talking about for the middle and high school doing lunch and I think targeting sports teams, but not a full, there's no staff there for full in-school tracing.
Where?
Northborough, Southborough schools.
Oh, so yeah, so Westboro is still doing full contact tracing in schools. The school nurses are.
Okay. I know one thing Northborough, Southborough expressed some help with is like the lunch. Like they're just like, we can't
Lunch.
call
They're going
every
to focus
kid
on the lunch
and say, who did
but-
you sit next to? You know, so maybe we'll be pulling those nurses in. We'll look at it more. The other thoughts we have, again, Isabella, just because, you know, not everybody's met you. Can you just speak to your background? Because I think we're really fortunate to have you and just so people can think about how we can best use you. So we want to talk about your contact tracing experience and really to the group would be really helpful.
Yeah, of course. So I am currently getting my PhD at UMass Amherst, but when the pandemic first started, I was contact tracing for UMass Amherst. So they, you know, have all those students and staff. And then I was also helping the town of Needham do case investigation. So I've done a lot of contact tracing and obviously my work in EPI, just making graphs, trends. So really I can be placed wherever the need is, which I know the schools are struggling a little bit. And obviously clusters are important. So daycares, long-term facilities and that.
So one thought I had for Isabella, like the schools are drowning this week. I don't want to stress anybody out in trying to offer help, right? Like that's not what we need to do. One thought that's really specific to boards of health I was thinking is, given Isabella's time, is just maybe asking, Isabella is set up with a phone. Actually, we have a phone number, right, Isabella? Should we share that? We can talk offline. We'll make sure to circulate that. I'll make sure you have everybody's contact. Maybe we can do like a quick introductory to each, so everybody has your email and your phone after this as a follow-up. But we all have daycares, right? And some are better than others, and they should be aware of the new
Right.
guidelines. But we could have maybe Isabella, during your set hours over the next week or so, reach out proactively to the daycares, let them know that, she's here as a contact. I was just thinking it's helpful because they were all calling me. They're calling the
Yeah, me
office.
too.
Right,
Yeah.
I'm getting a lot of
And
daycare
so,
calls.
and I mean, maybe we can have Isabella do an intro. They may still call you, but if you guys are comfortable, at least that gives Isabella, a way to make contact. She can familiarize herself with EEC and just be one more person to refer. And then I think Isabella, just because, we got to be cognizant, you have 19 hours and it could go very quickly. You got to let us know if it's too much, or, oh, I'm getting so many calls, I can't get anyone back, and you might need to rehash. But I think I would love in Northborough, and you guys can speak for your communities, you to proactively reach out. Another source of resources, want to make sure you have the correct links. Do you have questions? Maybe we can even make an FAQ for our communities, with your contact on it. And while the schools are figuring out their thing, I love it in Northborough if we could focus on just being a resource for our daycares, letting them know we're here to support them. All of their new testing programs, test and stay. I'm sort of like, oh, I don't want to touch it with tempo pull. That's like a whole nother thing, but it would be good. Maybe just a quick intro. Do you have questions? What can we do for you? And then just sharing, making sure they have the most current links. And that sort of
Westboro
thing.
would be interested in that as well.
Okay. The other thing, I can try to share my screen and sort of show you what Isabella pulled together. So we were trying to do some graphics. So I had made ones originally for like isolation and quarantine. And then of course, obviously they changed everything constantly. So I'm just, bear with me a minute. I'm gonna see if I can pull up, or do you have those right there, Isabella, the Q&A, the quarantine and isolation? I've got them right here. Hold on. So Isabella made these. We could even maybe have you adjust one that's specific to daycare with like the hyperlink. So we were finding in Northborough, it was sort of helpful for people to just have like a one pager because the States is a little difficult to read. So I hope you guys can see that. This is one that, we modified from another one circulated by Jamie Terry, that could be specific to the schools. Mary Ellen, our wellness coordinator in Northborough, Southborough, provided some feedback. So it's just giving them really a one, symptom for, especially because schools, it's different inside and out. So the schools is a 2-pager, and here's our guidelines for isolation. But I think it's important to note, like the reason is about, it's important to put the symptoms in there because we all get caught up on what do you do if you're positive, and like the daycares are still going like, well, who can come to school without a test? So this is more specific to the schools, but we could make it more specific to EEC's new guidelines, if you guys think that would be helpful. And, I think the more we can give them resources that work for them and their families, and take the burden, I think, the navigating. So that's just an example of the schools, and I can follow up the email. This one, Isabella, can you speak to? This was more like a town hall employee, general worker guideline.
Yeah, so this is really just general for, I think, primarily town staff, but it really could be for anyone, any resident too.
Yeah.
Now
So
you'll be sharing this with us?
Yeah. So we'll get it out. We won't call them final yet. Maybe what we'll do, Isabella, this week, if you could make one for EEC. And then so it'd be like schools, EEC,
Right.
general public, and then like on this, we called it fire, but we should just maybe make
Employee.
it generic to healthcare workers, including paramedics, because I know a lot of you, there's that other category, school nurses.
Right.
So, and
The
then
school nurses and the EMTs, right, need that negative test to go back to work
Yes.
for day 6 to 10.
right. So this coloring here is for just general public or your town hall employees. Again, having that same, like, we just modeling the symptoms over DESIs because they've done a nice job in keeping that updated. And then this last one would be, maybe we just work a little bit more, Isabella, on like the title.
Yeah.
I know we had like done it with the graphic, but if we can bring that down and have the title, like specific healthcare worker, and then specifically list like our most common, including town staff, that would fall under that.
Perfect.
Right, and on the EEC, I mean, the obviously it'll be in there, like the 10-day isolation just is not doable for a lot of them with little kids and the masking. So it's like,
Yeah. I would say for the EC, like it might be 3 pages with the third page being frequently asked questions. What if my child can't wear a mask? Like it might be in the flow, but if it's easier to call that out
Yeah.
as a common question, or what do I do if I can't get a PCR test? Or how do I document an antigen test and who do I send it to? All those like ones that we're probably dealing with all the time could be helpful.
Okay.
So.
And Kristen, do you think we could include preschools as well as daycares? I think there's a lot
Yeah,
of
that's,
questions coming up there.
And I still get confused. So yeah, we'll have to figure, yeah, the category. I think you're right. We got to categorize it preschool.
I think it's sort of right, because it's under 5. I mean, basically, they might be 5, because we have some preschools we're advising, and the kids are now 5. I mean, it basically is like
It's split.
preschools and daycares can go up to 5 as well.
So yeah, that's a great point, Chelsea. Okay. So Isabella, even on your follow-up, so you're going to send everybody an email with your contact information to our health departments. If you could send this as, whenever you have the draft done. And then before we make it official, we really want to have everybody just mark it up or email back. Isabella's fabulous at communication. I've learned in the past couple of weeks. She's pretty good at figuring it out. And so maybe we can incorporate everybody's edits, make a final, and we can make a landing page. I do have a Greater Boroughs website that's just landed on the town's webpage. We can just dump it there. So then you guys can take it off there or hyperlink from there, and we can try to keep our most recent versions. I think obviously with everything, we need a revision date. For me, separate documents with everything hyperlinked. So, people can click through to DESI's, or they could click through to EEC, or, where do you get tested? Hopefully we could hyperlink to our, test centers in the area. I think the other thing that would be helpful, I know the questions we get from daycare, just where do I get tested? What
The
sites are
EEC
currently-
sites, I mean, you have the info for the EEC specific sites.
Right, that should be in the document, like the EC, but
Okay.
yeah, maybe that's an FAQ, right? Where do I find a test? And,
Right.
so if it's
Right,
just,
because, they need I thought they needed the daycare provider's number when they go to one of those sites.
okay. All right, great. So I'm just, I'm peeking back at our agenda here, just making sure I may have bounced around a bit, so I apologize. So it looks like,
And Isabella, do you want, I mean, I sort of made my own list of some of the daycares and preschools in town. Chelsea might have some others, but, because I kind of reached out to them recently about ordering test kits.
mhm. All right, great. And then, yeah, so the other nurses I think I know they've been very busy in Boylston. And we're just trying to, but Jen, if you're struggling with your seniors or you need time, we do have those other nurses, think about it. And I think we're all just haven't had time to step back and come up with a plan. So we can work directly. You can reach out to me and we'll coordinate that. So again, let your schools know, let your administrations know that like really the scope of the grant has changed. We're here for you. Obviously we only have so many people and so much time. I think we can adapt and meet more frequently if needed, or just work one-on-one with towns within everybody's ability. And so with Maven Access, all the Salmon nurses that Amanda Jesse I mentioned that's helping to close some cases through Salmon with us, she wasn't on the original list, so we can pull her in. Possibly Heather in Boylston as well. Jen, if you end up needing those nurse assistants, the Salmon has nurses. It's just really like they're getting pulled with other towns as well. So they're only billing us for, Amanda for hours, obviously specific to this region. So I can inquire with Ann if you guys need help with closing cases or things like that as well, and pulling those nurses. So right now we have Maven Access for all the nurses through the 3 of our towns. Jen, what's your thought? Are you going to pull, Isabella, do you have access to Westboro yet? Do we need any more Maven letters?
We don't have Westboro.
So I
Okay.
reached out to Lionel and I said, please add her. And he wrote back, is she part of the grant? And I said, yes. He hasn't gotten back to me since that, but I'm assuming he's going to add you. I've requested it, so I'm not sure what's taking so long. But I'll reach out to him again today.
The other thing too, Jen, if you want to take the draft letter I sent you and just cut everybody out, leave Isabella, I can fire
did.
that. Oh, you already sent the letter. I don't know. They were funny for some reason saying Northborough has to send it. I don't know if that even matters. Whatever. There was a whole long chain in the process. So let me know what you need, Jen.
All
and
right.
We'll get that moving.
All right. Thank you.
So Isabella, I'll let you share your screen. Are you okay? Or I can pull it up on my end. Isabella, we talked a little bit about this dashboard and, our goal, and I'll let Isabella present. my goal is that, the public wants something, right? They want to understand where are we relative to everybody else. We want to be united as a region. We want to understand trends. We want to take the burden off of health departments for running these reports when we're drowning. So the idea is Isabella has spent time over the last week and pulled in her family members and people with skills on pivot tables and is going to present this to you. And I think the important thing I want to keep in mind, because I know we could all come up with 5,000 things we want in a dashboard. My goal with her 19-hour-a-week position is that she would really spend no more than 2 hours a week on this. The priority is to respond to residents and not just push out data that's available somewhere else, or that's so tedious. It's not the best use of her time. So keep that in mind, but go ahead and present Isabella, and she's done a great job.
Perfect. All right, can everyone see this? Okay, perfect. So this was just kind of like it's 2-page dashboard. So we were thinking of just uploading it as a PDF each week. But first of all, there's the 4 towns and then Massachusetts, so people can compare to Massachusetts. This data mainly comes from Massachusetts Department of Health. They post it I think it's every Thursday. So we would do confirmed cases, average daily cases, and then percent positivity. And the arrows would show an upwards trend or downward trend from the previous week. And then on it, we would have the current 2-week period, which is important. So they know, when this data is coming from, and hopefully it would exactly follow the Massachusetts. So we'd do the same time frames. We decided to use these 3 data points. We can obviously take one away, add one. There's, so many different ones we can use, but I think Kristen and I thought that these were the most informative for residents. And then we wanted to show some graphs just because that might be easier for other people to understand. The first graph is split up into towns. Obviously, I would add Westboro once I have Maven Access, but it just shows the last 2 weeks, how many tests were positive, and obviously the different towns color-coded. The next one is the positive cases by age, again, split up by different towns. So, 10 to 19-year-olds is our biggest caseload. The data table below it kind of splits it up into the age ranges and the exact numbers. If I'm not sure if that's necessary, but it does just kind of help people see where the data is coming from. And then lastly, our lovely epi curve for the entire pandemic. So this just really shows we're in quite a surge, comparing it to different time points, throughout, I think it's March 10th, is when it started. So those are kind of a very quick overview of what we could push out weekly. It really didn't take too long. And then this data came from Maven, directly from Maven. I basically just download all 4 towns, add them together, and then using pivot tables, make these different these charts and graphs. So I can send this out also, and you can provide feedback, any additions, edits, that would be great.
I'm just looking at this quick. I don't know my graph reading skills at this point. I'm tired today, but I'm looking at that, like the first count, that middle positive cases by cohort. If Norrisboro's at the 38, I would think the top of that graph should be light blue, like the first. But I just wonder if the labels were transposed.
Which one?
Like Northborough, like the middle graph, the first bar, 0 to 9. If Northborough has 38 cases. I guess the way it's putting totals. Yeah, it's just, I don't know if it's easier if we do 3. You know what I mean?
Right, it's adding the 12 plus 38. So Boylston plus Northborough is roughly 50. And then Southborough brings it up to like 75.
Yeah, so the colors on the graph don't help as much. You really got to go with the table to say what town had the highest, So I wonder if it could be the graph where it's like 3 side by side, at least to the age cohort. So you could see.
Although it's also tricky when you're covering the 3 towns, and that's why I like, this is all good. The first page, gives that kind of incidence because the size, Northborough, then Southborough, then Boylston. So yeah, when you see a different case count, but it's a different size as well. The first graph is a little, the date of positive assessment is a little bit, I don't know if it's quite giving the message in the sense that the testing sites are closed on Saturday and Sunday, so they always look a little weird. Because yeah, I don't know what that means to me, but do you see what I'm saying?
Yeah. And it's
it
also,
doesn't
those were the
always-
holidays.
Yeah.
Yeah, so it's not, yeah, I don't know if the first one's telling me as much as other things, but maybe not.
I agree.
But the
I
front
think
page and then
too-
these other by age is helpful and yeah.
So the other thing I wonder, I think it's good to see where we are. People want to know where we are relative to the pandemic. Like I like the last
Yeah,
graph, but
I like
maybe
the
that
last-
can be
yep.
like small, and rather than the percent positivity by date, maybe we take that down to a smaller period of time, like a 2-month
Mhm.
period, right? Like people want, they can look
Right,
down below. So maybe we start off with age cohorts on this page so people understand,
yeah,
what age category is
like the
really
age,
driving
yeah.
it. And then we could go like, here's our 2-month trend,
Yeah.
but then maybe just, smaller, and we can save a little more space down below. Where does this put us on the big curve, right? Okay. Are there any, so I guess we want this to be useful. And so, and I really love to take, the whole point of the grant is to take things off of all of you, not to just like layer on one more set of work. And I mean, would this actually take anything off your plate? If you guys are doing weekly reporting or
I
monthly?
do the Thursday, I do that one and then I send it out either Thursday night or Friday morning. So I mean, I guess that would be a bit helpful. I report the stuff that's on the front page, like the 2-week count, percent positive, that's from the dashboard that comes out Thursday at 5. Yeah. But would you do it by Friday morning or when would you do them? Because I think our town puts them out Friday morning.
I can do them Friday morning. It's really whatever works best. We were thinking Friday anyway, so Friday morning is totally fine.
Yeah, I mean, I don't want
Friday
to keep
morning.
doing, they don't take super long. I mean, for you, yes, because it's different towns. For the one, it doesn't take too long.
No, I can do that. That's no problem.
Yeah, Westboro's used to Friday mornings as well.
So we won't have time. I want Isabel to have time to sort of rework it, and you probably need to, check with your towns just to say, hey, we're going to make the shift. If you have a town clerk or if your Board of Health would want to, provide input. I guess what we'll do, Isabella, if you can work more today or tomorrow, just try to get us a draft. Like let's not try to change things by tomorrow, or actually this Friday might be too fast, but if you could work on reworking this a little bit, just based off our discussion, get everybody a draft. And if you guys all want to talk to your boards and committees or, town clerk or whoever, is part of your day's dashboard release, and see with this, could we use this in lieu? Can we move to this? Because it's one less thing on my plate. The goal is, again, to take it off of all of you. And so if you need to tweak, or your town says, I love it, but I only want this, then Isabella might be able to, shorten yours up or just print it with one, put whatever you need. So I want it to be useful. I don't want it, I want it to be helpful for everybody and worth Isabella's time as well. So please provide feedback. So again, Isabella's a follow-up with that email. Yeah, if you get this out with the other Q&A, maybe make those tweaks and circulate it around. And then I guess we just need to give Isabella clear direction by like next Wednesday. So she has her format ready to go. She'll pull the data on Thursday and we'll look to go live. So my plan would be we'll post it to our greater boroughs. Isabella is a North Borough place. I'm hoping I can just get you a user access account. You can just do that for everybody. You could hyperlink it or however you guys want to do it. Okay. Any other questions on the dashboard? Okay, awesome. I'm going to start moving quick because I know we're all drowning here. So just a update on our public health excellence grant. We're plugging along there. We do still have line items that I've just been too busy to spend. Like we have a clothing allowance, we have a beautiful logo, we are available to purchase requests for inspectional equipment and purchases, et cetera. I do have that grant money. So, if Jen and Westboro, if your food inspectors need a dishwasher temp disc or a new, bag for their supplies or, start thinking about that. If it's something urgent, and it falls into that category of the grant, we can do it right away. Or if we just want to sort of build a wish list, like I really need vests for my inspectors or whatever, just keep it in mind that money's there. I apologize. We had like great ambition early on when we got the grant. We're going to order X, Y, and Z. And then I think it's just been drowning. So the money's there. If it's a quick click at Amazon, I can get items to quickly and get them reimbursed through the town. And then if it's more like, hey, this is our wish list, get those items to me and we'll start building it up. So if you have items that fall under the grant, which is really inspectional equipment, And then we do have like our clothing allowance as well for all the greater Boroughs stuff. Get them to me with when you would like them by, and we'll try to keep pushing those. So I haven't spent the money. Northborough didn't run away with it. It's all sitting in an account. I just been too busy to really think about spending that out. So especially, I know everybody's like planning year end, budgeting for next year. So we do still have a fairly large line item to purchase equipment. So it could be everything from your, quat test strips for food inspections or something like that. Send it to us, we'll make it work. All right. And then COVID-19 vaccination clinic. So, we've been working together. We held the clinic last night at the Northborough Senior Center. Jen, that filled up. Thanks for circulating that through
Great.
Westboro schools. We had people there. Were great. Like I just got the email. Actually, one of our volunteers that works at all our clinics is like, I got the email through Westboro, and my daughter's here tonight. So that was really exciting. We do still, I'll have to double check. Our one on Friday is filled, I believe. We are going to need to offer more Moderna at some time. So we'll look to work through that if we're going to do it maybe the third Tuesday. So there's still appointments on this Tuesday coming up. Again, encourage your schools to register your residents. I want the boroughs to fill it, but it is mostly staffed through volunteers. Also, a lot of our school nurses, and the reason we did the 5 to 8 is for our kids. But the other thing I've learned, there's so many volunteers that are phenomenal, but they all work jobs and they love doing after work hours. So the 5 to 8's been this great window where our volunteers come out in mass. So we have people knocking at the doors. Hey, I want to volunteer. We love your clinics and I can't get in. Every time I register, like go, so it's awesome. So we have the capacity. It's a fabulous location. If you haven't been to the Northborough Senior Center, great parking. We're able to keep our supplies locked up there. It's the lightest lift. We've done a lot of clinics at schools. And, and right now they're in a surge. They don't need people coming into their building and moving stuff around, and they're all tired. So this seems to be working out, and we've had a great partnership with our senior center. So please feel free to come by. Right now it's all Pfizer's on Tuesday. We can look to add more Moderna. You tell me what you need, and we can keep pushing them there. So Jen, yeah, keep pushing it. If we don't fill it, I want to fill it when I have the vaccine, and 2, we have the volunteers. So it's like, it really seems like a wasted. So I would say, encourage your communities to register. I would think by Friday, I'm going to consider extending those open appointments to our other Metro West towns that we worked with the large regional clinic. So I'm thinking like Ashland, Holliston, Hopkinton, right? We were a community of 7 running the Doubletree site. I haven't done that yet. I haven't really said to the people, open to the public. The other option too is if we don't fill is to open it to the states online, find an appointment. Our color clinics can get linked through that. So I'll be looking to do that. But again, if you have anybody special situation, let us know. The other things that we've been able to pull off is even a few homebound. I don't want to overcommit because it really is dependent on our salmon nursing. So feel free to work with me and to reach out, and our nurses through the Public Health Excellence Grant, are available to assist. We're trying to limit, and they've really been focused on contact tracing. Erin, and for example, comes to the clinic, she helps to drop, and then we just send her home. Like she's been working plenty of hours. So hopefully that's really positive. And if there's any other needs in your community, I think all of us, like, right, Jen, we're sitting in Southborough too. We're all sitting on some 5 through 11 vaccine.
Mhm.
Is there any demand or need to add that? I feel like we've hit those clinics really hard.
I haven't really had calls for the 5 to 11.
No.
Okay. So, yep, appreciate your feedback, but I think it's an efficient way to support our communities, and I think it's a great way for the partnership. So we'll keep going that way. And we have been pulling Diane Legier as our, shared health inspector for, obviously not in Westboro, but Diane's working everyone as well. So we're really pulling it as a regional group, and it's a great showcase the grant. It's been a good benefit. So we'll keep those going. And I think look for, if people that want to register sooner than later, because we will open them up as if they're not filled moving forward. We struggle. We're going to see more and more no-shows, right? The longer people register in advance, the more no-show. So we can take walk-ins, not that we would encourage it because of the paperwork and it slows down the whole check-in. But again, if you have somebody that needs to get in, we'll find a way. Just reach out to me, or you could even reach out to Diane as well. Okay, so I think that's all we have for the Public Health Excellence Grant at this point. Just moving on COVID-19 testing. All of us have been getting emails and questions about the state bid to purchase kits and funding. And so it would be great to all do a similar program. So we don't, the whole point is to build our region and also to have each other's backs. Because I know, if you go get a ton of kits and hand them out, Heather, they're all going to call me and say, why isn't Northborough doing what
Right.
Southborough's doing? And I think we all want to do whatever we can for our residents. But I can tell you firsthand experience with our PCR machine for our employee testing program. We test everybody. The antigen we get free, right, as a local board of health. And so we're testing everybody with an antigen. If they are negative on an antigen, but symptomatic, et cetera, and known exposure, we'll run a PCR. So today we were 0 for 3, meaning they were all negative on their antigen, but extremely sick. I think we tested one person in each town today, and
Yep.
then they came back positive on the PCR right away. So it's really hard that we're talking about spending $50,000 in Metro West Health funds to buy kits that we firsthand are seeing are not working, right?
That's
Right.
crazy.
Diane said,
Right.
yeah, you're
That's
at
crazy.
about 70% or 60% on the antigen. Yeah. Originally she said 80%, but now it's dropping.
So it's hard. They were lining up, and we're seeing people that, and you're always like, oh, if they're early in infection, that's when it's not. But some of these people are presenting, fairly serious symptoms, like
Yeah.
the most congested person I heard, and then they're not.
Yep.
So I just, it's hard.
Is it the
'cause-
boosted
hard to
people
spend
that
that
don't
much.
show up on the antigen? I don't know. Is it the boosted people that aren't showing up on the antigen? I don't know.
I don't-
No, I can tell you mine was not the reason of that.
Yeah.
I don't know. It's crazy. It is hard to spend that much money on testing that is not completely accurate.
Right. They're saying symptomatic is 50 to 80%, and then asymptomatic, it's like 30 to 50% are showing up on antigen.
I don't know.
What?
I think we needed to be in agreement though with that, whatever we decide.
I
So,
agree.
But isn't the test and stay for that EEC, aren't those day 5, 6, 7? Those are antigens, kind of like the school does the antigens. So I was thinking to getting the antigens for the.
But EEC will be getting it directly through the new state process, right?
gonna
The new
say, yeah.
announcement yesterday, right? That they're buying what, 250 million?
million, yeah.
I also heard a slight rumor that some of those could be going to municipalities. So I don't know if that's for like municipal operations. So if you're thinking of purchasing kits, for municipal, you might want to wait a week and just see what that more news is coming out.
Problem
So-
isn't the grant due on Friday?
Friday.
So yeah, I have it
So-
drafted. So as we jump down to the Metro West Health Foundation, so well, I guess it's good. Boylston does not qualify. They're not in that region. But obviously Northborough, Southborough, and Westborough, and each community is up to 50,000. It does not sound all too competitive. It sounds like the money is there in terms of like, you don't have to, I think they have enough money to award each community 50,000 as long as it meets the category. And I think there is flexibility to change after the award. So the applications are due on Friday. They will have their board meeting on the 27th, an announcement, I believe, on the 28th, and funds would be available as soon as February 1st. So it's close. And so, yeah, I did just draft ours. It's pretty simple. I'm just looking at it. You have a cover sheet that you fill out, it just has like the name of the town, like really basic. I don't know if you guys have
Yeah.
done yours. Yeah, 1 2-page overview. I guess I'll have to double space that one. And then a budget in narrative form. And I think we all go individually. I don't think we need to necessarily do letters. It's just as easy to apply individually. So we'll be looking to do that. I think I'm just going to say generically purchasing at-home kits, and if we need to change it because they're not working. I think what Connor Robichaud with CMRPC spoke about, if we're going to give them out, we need to give those stats to people. We need to say, like, very clear, working with Isabella or someone else to make a fabulous flyer with the distributed kits that says these kits are only positive, X% and symptomatic, and people need to realize they're helpful. A positive is a positive, great. But that if they have
they're
no
sick and
exposure
it's
to
positive,
symptomatic,
yeah.
it's pointing them on where to get tested is really our next step. So, okay. So it sounds like we're all going to apply. for, including test kits, I know Heather, you had some other ideas too. We could talk about that a little bit. So one thing Heather mentioned, Northborough, we have the Abbott ID Now machine, right? It's this like $5,000 either by rent or we purchased it outright in Northborough by CARES Act. I spoke to the vendor today for McKesson who provided that. It was a very long process. He said that they're not taking on new clients now. So I know Heather, like there was a question about whether or not, and the reason they're not taking on new clients is they can't guarantee kits. They can't guarantee a single kit. So you could invest in this and go through this whole process, and they already have angry clients that they've had for the last 2 years that can't get kits, and they're basing allocation off of your 8-week order history. So they're not even entertaining new. They're saying our clients that we've had using this equipment, buying the kits regularly, what is your 8-week order history? And I'm like cringing because we pre-ordered and we bought them all with like CARES, and now we're ripping through them, but they don't see that in the numbers. So I am getting one more kit. I mean, we are rationing. And I said, is there a projection? Like GBPH's colleague said, this vendor is opening a new manufacturing facility and they're going to he said, no, we have no idea.
So even if we got the Metro West money, we can't.
Not with the Abbott ID Now.
With Abbott ID.
I mean, there's so many vendors you could purchase items from. There might be another vendor, but for him, he just said, we really aren't even taking on new clients because we just don't want people that are upset. We're going to give you a machine. We're going to go through this process and you're not going to get kits. Like and they already have.
Can't use it. Here's your machine, but you can't use it.
I feel like the strength of our region, or even extending to our 7 towns as part of the vaccination plan, I really feel like we should be pushing the state and our state reps and people we need expansion of our existing PCR testing sites. Like, why are we trying to solve this when New England Sports Center, with the UMass system is doing a phenomenal job, but they're closed by 10 a.m., right? Like they're not testing for 4 hours a day. They're testing for 2 hours a day. And close that shop. Yeah. I mean, and it sounds
I
like
think they're really trying to do without PCR testing. I think they're trying to weave their way out of that and going to antigen only. That's what it seems like to me with them buying that many kits. They're telling you
right, and I think officially it says most of these PCR sites close in end of March. I think it says open through March.
So I really think they just push the antigen, which is crazy with what you've been finding, but
yeah. Okay, so I would say as you're going through your application, Heather, I said that to McKesson. The McKesson rep, I said, is there another product, another brand? Like, what can we do? And he's like, oh, I got this other, there's only one he has that they have tons of availability. You can run 5 tests at a time. And I'm like, this sounds amazing. He goes, it's antigen. I was like, I don't want antigen.
5 tests at a time.
I don't care if it runs 400. I want PCR. And so
no, I have antigen.
It's a supply issue. Yeah. And, the state is still, now they're only sending local towns, I think max of 4 of the 40 boxes a week. So they still have
them. It's 160 a week. Okay.
Max, but probably changed this week.
We don't need that many.
Yeah. I mean, Boylston's done a phenomenal job with their fire department, and they are testing so many people and really doing an incredible job. But they're running out of kits. So, I mean, I don't know.
Right. We just sent some up there. Yeah.
Yeah. So it also might be something we're talking to the state. If Boylston wants to keep that going, can we request kits, send them there, and then send our people there for an antigen if they really want? I wish. I don't think Chief Flanagan needs more work, but any of your fire departments, Westboro, Jen, you guys have interest in doing the antigen like the Boylston model?
He really wanted to, and he tried, but he realized that he was getting false negatives. He's like, I don't want to push something that I know is not working.
Yeah,
which makes sense.
What about you, Heather? Is Chief Achilles considered doing a similar program to Chief Flanagan?
I don't think so. What it exactly is, I mean, Achilles has said, I'll offer to help me. Like we do them, Taylor and I, and, if we're out at a clinic or, I think he did one for us last week, when folks are looking for one, when we're not around. But what is Flanagan? He's doing residents as well, right?
Yeah, so they've been doing it since August.
Residents.
Their residents just pull up and they're testing them. I mean, our fire, I don't have the parking here at Town Hall, and our fire department is in the process of getting a new building and they have no parking. It's like, and he's like, we're so busy, there's no way we could be doing that here. So, okay, so before we all look, I know Chief Flanagan's making us all look bad now. He's doing a great job over there, but okay, so it sounds like we're not going to be stepping up antigen testing for many
So,
reasons.
but he's able to get enough from the state to do that?
Well,
But it's a
Yeah.
smaller town. I don't think
It's
we
a
can get that much
smaller-
from the state.
I mean,
to
I'd be
do-
happy to share
Right.
ours with him. I just don't know the rules. I don't want to break any rules with the state. So I
Right.
guess we can reach out. Jen, are
Right.
you in Westboro? Are you guys requesting kits often, or are you just, you're just using them for employees, or how are you
We're
guys?
doing
Yeah,
employees.
we're just doing employees.
Okay. Okay, so stay tuned on our PCR availability. Our FEMA can pay for the test kits if you're just
But
doing
you
it
can't
for
get them.
safe operation, if we can get the PCR test kit. So I told our vendor to keep us on the list and order as many as you can until I tell you not to. So I have that one box. I mean, Westboro, your box is still very full. We haven't used too many. Southboro, you're getting low. We'll have to work out the details. Either way, it's 100% covered. I guess we'll have another conversation about ordering more boxes when we actually can get more boxes. So if I get that invoice, we can pass it to you and we can label the box again, Southboro. So you guys both do have test kits remaining. I think the one thing we'll need to think about for sustainability, I'm looking to work out here, is just our staffing. Because right now I'm pulling Diane and she has
Yeah.
other things to do and I'm running downstairs and, I hope this isn't forever. We'll do it like we're a region. But that's something I'm trying to solve locally too. So anyway, and Jen is, Jim has more availability. I know he's out this week and I'm happy to do that because we're just trying to fill, but also Jim is trained on the machine. He has a key to that room. Heather Taylor is trained on that machine. I think, are you as well? So like,
Yeah.
yeah. So it is pretty user friendly once you walk through it a few times. And so we might need to work through that, but there might be a time where I say, hey, I'm flat out. I can't
You
run
guys-
it, but if
yeah,
you
yeah.
can send Jim over or Taylor wants to come run it, that might get to the point. We're doing what we can now. So stay
Yeah,
tuned.
no, it's a lot.
Okay, and then next on the agenda, we just had mask mandates, and so it sounds like congrats, Southboro, you joined the other other mask mandates. One thing that I'm struggling with, and I'd love to talk about, and for the public, I have no vote taken. Like we're not making our own today. We're sort of just talking about what's in place. And Northborough, we're struggling because obviously we all had like a town hall mandate. And our mask mandate has nothing about social distancing, right? Like you can take off your mask, like it's just like wear it all the time in public, indoor places. And so we're struggling with employees at desks. And it's fine if they're at a desk and it's a closed door, like my door is closed now and the public doesn't come in here. But I'm just wondering for these shared office environments, that you
Right.
have, what are you doing?
So we have
Input.
our own advisory we put in place just for municipalities, buildings. So that clearly stated 6 feet, you can be in your own space as long as you can keep the distance. So I can send you that.
Okay.
But that's for the municipal, but what about somebody emailing me today, right? That we're in a shared office building, when we're in our own, particular company, for our private business that's not open to the public, I would read that as that
It
particular
doesn't-
business is not open to the public, so then it doesn't apply.
That's how we're following that. And
Yeah.
ours specifically says 6 feet in ours. So
Yeah.
if it's a private building with no public access, it's not falling under that mandate.
Right, I mean, there's access in the general part of the building, but in the particular suite, and within the suite, it's a private, I would see that as not open to the public.
Yep.
Okay, so it's more about, just the areas where the public, like hallways and bathrooms and
Yes,
those sort of things. Yeah.
exactly, because it is a public building, but there are private suites. Yeah.
Okay, no, that's great. Jen, how's it? Talk about your billboard. I'm so impressed by that.
Oh my gosh, we have the most beautiful billboard. It's got every race and color and it's just beautiful. I'll share the picture. Actually, I'll have Kristen has it. She can share the picture. I don't know everybody's email.
Yeah.
So, but it's great. It's right on Route 9. Looks fantastic.
Which way? Eastbound, westbound? What's it
East, I
there?
believe it's east. I'd have to look again.
Okay, I know you guys have a few there on Route 9. I haven't seen it. I'm like, but it's just great because it just says like that Westboro's passed it by Westboro Board of Health. I mean, you think of Board of Health is on a billboard. But
I
it also
know.
helps the businesses, right? Like,
Yes.
if everyone drives by and realize, and I think people want to do the right thing, but it's hard when the rules are so different town to town.
I love it.
Yeah. And so for your boards, because I think just like we talked about trying to act together and ordering kits or distributing to the public, are you guys, what's your plan to keep it in place? Your like, your off ramp to your mask mandates, or the next time you're meeting, are you just meeting once a month, or how are you handling it in your communities?
I'm sorry, I missed the first part of that. Was that the board meetings you're talking about?
Yeah, like when would you next review the mask mandate? What do you foresee as like how long that would be in place?
So ours is in place until the end of January and it's being reviewed then.
Okay.
Yeah, we have, I think it's visit February 8th, that when the next board meeting is, it'll be reviewed again. I mean, I think we look at case counts in town.
Yeah. Okay. We're February 8th as well.
And any hospital, and any over surge on local hospitals. Probably.
Okay. Okay, that sounds good. So I guess next on our agenda was additional funding opportunities, which we've already really covered with the Metro West Health Foundation. So I guess we'll look there. I think that if we do purchase them in Northborough, we'd be looking for sure. Just Meals on Wheels, like for our seniors, we'd be putting them in there, handing them out to our Fording Housable Complex, giving them to our youth and family services coordinators, just so if they know families in need, they'd have sort of them to distribute.
Senior center, obviously.
Yeah, senior center outreach
Fire
coordinator.
department. Yeah.
Yeah.
Fire, yep.
Did you guys have a count in mind, what you were looking to purchase for your communities for sort of those categories?
I asked our housing and our senior center, in our daycares, but I don't know if I've even done the total yet, but I did reach out and get. But it's not a huge number. So I don't think combined we'd make that 15,000 or something for the eye health. I don't think it was a huge number.
Right. Yeah, because the one thought is, I don't know where you guys come in. If you, in the next couple of days, you'll think of other things, or maybe we realize the tests aren't working. We all revamp how we want to use the funds that they're awarded.
Right.
But we could, because some of the companies have those minimum. So let's say it's a minimum of 15,000, and we can do an MOU and have one town order just to hit it, or CMRPC is placing, but they're placing an order this Friday with the Metro West Health Foundation funds. We can't place the order until we've actually received them, because a lot of the vendors require prepayment. And so, we'll be holding off on placing any orders until February.
Yeah. And like I said, I asked those targeted areas and I came up with a number, but it's less than 1,000 for Southborough, for our vulnerable population.
Okay.
I haven't done that homework yet.
Okay. Yeah. All right.
Kristen, for other funding opportunities, I've asked a firm that we utilize at the town level, who's helping us with ARPA, to analyze and provide opportunities in Governor Baker's ARPA bill that he passed. So to the extent that there's anything public health related, I can certainly pass it on to this group so that we can either look at it at a regional level, or if there are certain things that make sense to do at one town, at least where we all have the same kind of information and opportunities.
That sounds awesome. Because it's the same thing, just like the test kits. It's going to be like, well, they did this with their ARPA funds.
Yeah.
Why did you do not do, so, and also.
And it's out of our control too, though. That's the problem. You know what I mean? Like, we need to get permission. So hopefully all towns will realize that if others are doing it, then ours will follow suit.
And this is in addition to the local allocation from ARPA. This is kind of what the state is allocating from their level. So this would be like an application process for specific funding. Like one of the things that I think is in there is digitizing records for public health departments. And that would obviously be something I think that the most towns in this group would be interested in. So if we could, use it as kind of what we got from the other grants and, software systems for the towns, and there's some sort of cost benefit analysis done on that, maybe that would make sense to pursue.
That would be amazing.
Yep.
Yeah. Okay. Thank you, Chelsea. That sounds exciting. So, okay. So just moving on next, confirm our future meeting dates. I know this meeting was postponed. I just want to stick with the March 9th and June 8th meeting dates, if that works for all of you. Check your calendars. If not, let us know, but we'll look to keep it the quarterly. And maybe we need to meet sooner if we all need to come up with a plan on test kits or task force or whatever. You just let us know. And then I guess lastly, are there any other business like you guys would like to discuss today before we close?
Nope.
Okay. All right. Well, thank you, everybody. I guess we'll do
Thank you.
motion to adjourn, which I always forget.
I'll make a motion to adjourn our meeting.
Second.
Okay, roll call. Kristen, yes?
Jennifer,
Heather,
yeah.
aye.
Okay, and all right. So, all right, motion to adjourn. Thanks, everyone.
Thank you so
Thank
much.
you.
Bye.